So at the end of this presentation, there is some messages I would like you to remember, and I would like you to keep it in your mind. The first message is that when you have a patient coming to emergency or coming to your clinic with a history of cancer, you should remember that patient is immunocompromised by definition. Two, you should remember that if there is something, we call it oncological emergency. So this patient in front of me, he's high risk that he will have oncological emergency. So from this lecture, I think I gave you the basic knowledge about oncological emergency, what I should do, who I should consult, which treatment I should start. This is what we call it a basic knowledge about oncological emergency. The second thing which is really important is to do some blood test, and it's not just requesting the blood test and you don't know about the result. You should follow the result, because this will help you to identify the source of problems, and this also will help you to treat the patient. The third message I would like you to know and to understand is actually what I see here in our hospitals in the kingdom. There is poor communication and poor documentation, which is not really good. It's not helping a patient. Some studies done show that the medical errors is increasing with poor communication and poor documentations. And if you have a good system for documentation, this will decrease the medical errors. The other important factors, or the other important message, is identification of risk. Let's say I have two patients. One of the patients actually diagnosed by cancer, long time, he's on treatment, he's doing well. The other patient, he's diagnosed with cancer, he had history of MI, and he had history of, let's say, deep vein thrombosis. This patient, the second one, has a high risk if you compare it with the previous one. So remember, there are some risk factors increasing the patient risk. All the time, remember to review all the admission orders, all the admission history, all the admission examination. And if you see there is a gap, you should go ask the patient, take other history, do other examination if you are not happy about the history or the examination. Other important message I would like you to do or to remember is all the time educate patients. Okay, when you have a patient, let's say, diagnosed with breast cancer, and she had or she has metastasis, I should tell her what's her prognosis. I should tell her that maybe she will have, let's say, back pain. I should tell her that she may have metastasis to her lung. I should, let's say, have a patient with, let's say, thyroid cancer with retroesternal extension. I should tell the patient that maybe there is a risk of upper airway obstruction. If you start to have hoarseness or dysphagia or difficulty breathing, immediately come to the emergency. If you do that, this will help us to identify the problems earlier and to interfere earlier.